Hi, this is Dr. Madhava. I'm an internal medicine physician, board certified in addiction medicine, and a functional medicine practitioner. In functional medicine, we look for the underlying cause of symptoms and disease. I have a lot of experience in addiction medicine, having worked with patients with addictions and use disorders for many, many years and in many, many capacities. I have worked in inpatient detox, rehab, in methadone based opiate treatment programs, in outpatient primary care clinics, and in the jail system treating addictions. Our conventional treatment options are limited for those seeking treatment for use disorders and is really not personalized to the individual in front of us. Treatments are mostly focused on psychotherapy and a few medications. So the persistent rate for addictions tends to be high. But there are ways to treat addictions from an integrative, whole person perspective. For example, focusing on good whole foods, balancing brain chemistry with targeted amino acids and nutrients, looking for and addressing gut dysfunctions and toxic exposures, and other such root cause evaluations. I am the owner of a functional medicine based private practice for the treatment of addictions called Brain Body Medical, where we offer comprehensive and personalized treatments. Today, I'd like to discuss the root causes of alcohol associated liver disease. What is behind the diagnosis your doctor may give you? What I'm going to talk about today is a new and unique way of looking at alcohol associated liver disease. I have evaluated the enormous amount of scientific information on this topic, and I'm presenting it in a way that I'm hopeful you will find useful. I'm also hoping that by knowing and understanding this information, you will be empowered to seek the help you need. Always work with a knowledgeable practitioner, either a functional medicine practitioner, a naturopath, or a knowledgeable herbalist. In this video, we're going to just talk about the root causes. And in the next video, we will discuss some things you can do to protect and heal your liver. Again, it's very, very important not to do this on your own, but to work with someone who's knowledgeable in functional medicine or naturopathic medicine or a herbalist. This is a picture of a human body. The liver is one of the largest organs in the body. It weighs about 3.5 pounds or 1.6 kilos. It performs a lot of very, very important functions. It is the clearinghouse of the body. All the blood from the gut, the small intestine, and colon goes directly to the liver before it goes to the rest of the body. When we drink alcohol, some of it is cleared in the stomach, but most of it passes into the intestines and it goes directly to the liver. Again, the liver does a lot of very important functions. The liver processes the nutrients that are absorbed from the intestine. It breaks them down, balances, and creates other nutrients that your body needs. It helps clear your blood of harmful substances like alcohol. It makes bile, through which it excretes waste, and bile is important for fat digestion. Having a good functioning liver is very important to have a healthy body and a healthy life. The hepatocyte, or also called the liver cell, is one that processes most of the metabolic functions which we just discussed. It comprises about 75% of all the cells in the liver. It performs an astonishing number of metabolic, endocrine, and secretory functions, some of which are shown here. The Kupffer cells are the immune cells that protect the liver from bacterial infections. And the stellate cells provide the liver with an ability to respond to injury and heal certain kinds of damage. This is a picture of a gentleman drinking alcohol. It shows that a normal liver can progress to having a fatty liver, also called steatosis, which then progresses to hepatitis and then to cirrhosis. This picture is not entirely accurate, which is what we'll discuss shortly. This is another picture that we often see about the spectrum of alcohol-associated liver disease. It shows a normal liver. This is what's seen under a microscope. When you take a piece of liver and you look at it under the microscope, these are the pictures that you see. The top picture is of a normal liver. And once you've had 3 or 4 drinks for several weeks, when you look at the liver again under the microscope, you'll see something called steatosis, which is fat in the liver. As it states here, you can have reversal of this once you stop drinking alcohol. But if you continue drinking alcohol, the fatty liver can progress to either steatohepatitis and or fibrosis. And from this picture, it shows that both of these liver diseases can progress to cirrhosis, which then progresses to carcinoma and or liver failure, which is also called decompensated cirrhosis. Even though this shows a normal flow of what one can expect with alcohol use, this is not entirely accurate. In this slide, we're going to discuss exactly what happens, the root causes of liver disease. At the top, you can see, healthy liver. When it's exposed to chronic alcohol use, just about everyone will get alcohol accumulation in the liver called alcoholic fatty liver. The reason you get that is because of the way the liver cell metabolizes alcohol. No one can escape it because it's just the way the liver functions. The liver sees the alcohol as being toxic, and then it wants to get rid of it. And the way it gets rid of it causes the accumulation of fat in the cells. So I call that a metabolic dysfunction. Just under the green dotted line is another mechanism, another root cause of alcohol-associated liver disease. So this half of the slide, the dysfunction is due to a disrupted gut. A disrupted gut causes changes in the liver, particularly to the Kupffer cells and to the stellate cells. And once you have changes in these two cells, eventually you'll have disruption of the main liver cell called the hepatocyte. So this dysfunction is due to immune activation and inflammation. So it's a very different mechanism than what happens on the top half, which is more of a metabolic dysfunction that mostly affects the liver cells. But you can see that the green line is dotted, meaning that there is some of the products from the metabolic dysfunction that goes toward immune activation and inflammation, and also vice versa. We'll talk about this in detail shortly. The red dots are significant. So alcoholic hepatitis is a very severe form of liver disease. If you have severe alcoholic hepatitis, at the present time, there's not many treatments available. Severe alcoholic hepatitis manifests as jaundice, maybe some pain on the right side of your abdomen, maybe fevers, just generalized weakness, and often many patients are in the hospital. So the main treatment for alcoholic hepatitis is liver transplant. They often try to give prednisone, which is a corticosteroid, but it's not completely effective. The other area with a red dot is alcoholic cirrhosis. If you have severe alcoholic cirrhosis, then that may indicate that your liver is not functioning very well. If your liver is not functioning well, that's almost like end stage liver disease. And so at that point, also, you may need to get a transplant. There are not very many treatments right now for severe alcoholic cirrhosis. And on the right hand side, you can see the red arrow and the green arrow. What that means is if you have early alcoholic cirrhosis or fibrosis, once you stop drinking, you can have complete reversal of all of these changes. So the two main mechanisms of alcohol associated liver disease is metabolic or immune activation and inflammation. This is a slide, a picture of someone with a fatty liver. You can see areas of white, which is accumulation of fat within the hepatocyte, within the liver cell. So why do you get fat accumulation? As I said before, it's because of the way the liver metabolizes alcohol. So once the alcohol is absorbed, it goes to the liver, and the liver has three mechanisms to get rid of the alcohol. Pathway one is the most common, which is using two enzymes. The first one is alcohol dehydrogenase. So you can see that ethanol using alcohol dehydrogenase goes into acetaldehyde using NAD+. Acetaldehyde is then metabolized by aldehyde dehydrogenase to acetate and water using, again, NAD+. Acetaldehyde is toxic, so that's something we may not want to have a lot of in our system. In pathway 2, you use the enzymes from the cytochrome P450 system. You use the CYP2E1 enzyme. This uses NADPH. This is a kind of B vitamin, and you generate NADP+, and then you generate reactive oxygen species. These reactive molecules are very problematic for the body because these molecules have an unpaired electron, and an electron does not like to be single. It wants to be completed. It wants to have another electron with it. So it goes around to different areas of the body, particularly the cell membranes, and it tries to get electrons from different areas of the body, destabilizing different kinds of cells. That's called oxidative stress. The third pathway that we use to metabolize ethanol is via catalase, which goes to acetaldehyde, and that again uses NAD to get to acetate. So at the end of the metabolism of alcohol in the liver, you have three different compounds that are not so good for the liver cell. You have a high amount of NADH because NAD plus is being utilized. You have a lot of acetaldehyde, and you have a lot of these reactive molecules that are generated because of the CYP2E1 system. Pathway 2 is usually not used. It's only used if we drink too much alcohol or alcohol cannot be metabolized by pathway 1. So when you have too much of these three kinds of molecules, these are all the metabolic effects that you can have in your liver and elsewhere in the body. As I said earlier, the liver is responsible for more than 500 different kinds of pathways, and having these molecules can affect all of these different pathways, and you have these different kinds of products that are generated because of the dysfunction of these pathways. In particular, you can see here why you get fat accumulation in the liver. Here you can see that in general, when you have a lot of NAD pluses, you are able to generate glucose and store glucose. But when you have more of the NADH, glucose is now converted through different mechanisms to glycerols, which is similar to triglycerides. And then you have accumulation of this excess fat in the cells, causing fatty steatosis or fatty liver. So we just now talked about how we get alcoholic fatty liver, and that's because of the way the liver cells break down alcohol. This is the metabolic pathway of why we get alcoholic fatty liver. Now we're going to talk about why we get alcoholic hepatitis and alcoholic cirrhosis. This is a very important slide to understand. This is a slide that I've used before in a prior presentation, showing the disruption of the gut-brain axis. In our colon mostly, we have different kinds of microorganisms. We have bacteria, viruses, archaea, different kinds of organisms that really help us. They help us make vitamins and fatty acids. And when we eat good kinds of food, which are these, you have a balanced microbiome, meaning you have a few not so good bacteria, but you have the majority of really good bacteria that helps us keep our mucus layer, which is shown in yellow, and keeps our intestinal cells, intestinal wall intact. So having good bacteria helps keep this epithelial cell layer intact. When we drink alcohol or have not so good foods as shown here, we have an imbalance of the microbes in our gut. And these imbalanced microbes cause breakages in this cell wall. And once we have breaks in the cell wall, that's called a leaky gut or increased intestinal permeability, you have bacterial products getting into our system. Once you have these bacterial products in our system, if it goes to the brain, it causes neuroinflammation. And if it goes to the liver, it disrupts the liver Kupffer cells. Here again, we see that in another slide. So here, alcohol, we drink alcohol, it goes into our gut. We have an imbalance of the microbes in our GI tract. We have more of the gram-negative bacteria. Since we have increased intestinal permeability, the leaky gut, we have leakages of lipopolysaccharides or endotoxins that now go to our liver directly. The liver sees these bacterial products as being something that they need to deal with. So the endotoxin goes to the Kupffer cells, and you have generation of these cytokines and these reactive oxygen molecules. So the endotoxin sort of causes activation of the NF-kappa B pathway. And then we have these reactive oxygen species and TNF-alpha and the interleukins. These are inflammatory agents, and in general, they will go ahead and kill off the bacteria or whatever is causing the liver cell to be activated. As long as we have just a little bit of the cytokines and these inflammatory products, our body is able to take care of it and eventually suppress the inflammation. But once we've continued to drink alcohol for a prolonged period of time, and we have this disrupted gut microbiome, and we have increased intestinal permeability, once that goes on for a long period of time, it eventually overwhelms our system, and then it causes injury to the hepatocytes, which is the working cell in the liver. So when you look at the liver cells, this is what you see. You have a lot of the inflammation here with neutrophils and some of the hepatocytes dying off because of the reactive oxygen species and the inflammation. So what's the proof that we have that a disrupted gut microbiome is the cause of alcoholic liver disease? Here you see in this paper, what they say is if you somehow decrease the amount of gram-negative bacteria in your gut, you can get decreased liver disease. If somehow you can destroy the Kupffer cells, and they have different mechanisms of doing that, you can decrease the amount of liver disease. If you somehow prevent the NF-kappa B from activation, that also will decrease alcoholic liver disease. And giving anti-TNF antibodies, which are the cytokines, that also protects against liver disease. And what they found is that if a patient or if the mice had fewer antioxidant enzymes, they're at increased risk for liver injury. And giving antioxidants such as vitamin E or epsilon or superoxide dismutase or glutathione precursors prevented alcohol-related liver injury. So these are all processes that they showed that if they somehow were able to blunt the action of any of these kinds of pathways, alcohol liver disease was prevented. So this really shows you that having an intact gut, having a gut that works well, is very important to prevent alcoholic liver disease. This is also a very interesting study. This was done recently. What they found is that in folks with alcoholic liver disease, they had one species of Enterococcus faecalis that was more frequent than any other kind of bacteria. And this particular kind of Enterococcus produced endotoxins called cytolysine L and S. And about 30% of patients in this study were also positive for cytolysine. And when they transferred the Enterococcus faecalis to mice who had a normal liver, they eventually developed hepatitis. And when they gave the mice treatment that prevented the cytolysine from being formed, it resolved the hepatitis in mice. So this shows that if you can somehow figure out the cause of the hepatitis, which is maybe different kinds of microorganisms, but in this instance, it was Enterococcus. If you're somehow able to prevent the infection or prevent the release of the toxin, you can get resolution of the alcoholic liver disease. The liver fibrosis and cirrhosis starts as a mechanism to repair injury. The injury caused by inflammation or oxidative stress, the gut-derived endotoxins, can injure the Kupffer cells or the hepatocytes. So once the hepatic stellate cell is activated, it increases collagen synthesis. And when you have a lot of collagen, that is the cause of fibrosis. When you have a lot of fibrosis over the years, over the decades, that leads to cirrhosis and end-stage liver disease. So think of fibrosis as scar formation in the liver, like you would get scar formation on your hand after an injury. It's similar to that. So when you have cirrhosis, there's especially when you have end-stage cirrhosis, there's not much you can do for it except transplantation. But as long as you have early cirrhosis, because the liver has an incredible capacity to regenerate, you can get your liver function back. So if you stop drinking or if you use different kinds of products to help you heal the liver, there is a good possibility that your liver can regenerate and you can get back to normal functioning. So these are some of the root causes of alcohol-associated liver disease that we talked about. We discussed earlier that decreased NAD+, which is a kind of B vitamin. When you have decreased NAD+ in the liver cells, that can lead to derangements in different pathways, leading to eventually a fatty liver. Increased acetaldehyde, increased oxidative stress, decreased antioxidants, imbalanced gut microbiome from continued use of alcohol, which disrupts both the intestinal permeability and the kinds of microorganisms you have in your colon, can lead to increased immune activation of the Kupffer cells. And activated Kupffer cells are trying to limit this infection, and so that creates increased cytokines and increased inflammation. So these are the root causes of alcohol-associated liver disease. And in my next slide presentation, I am going to talk about harm reduction methods of how to help repair your liver as you're decreasing alcohol use. As I mentioned earlier, it's really important to work with a knowledgeable functional medicine or naturopathic doctor or a very good herbalist. It's important to do testing, functional medicine testing, both blood and urine, and of course of the stool, checking the gut microbiome, and treating appropriately, targeted to what you need. So everyone is different, so we can't just give everyone the same kind of treatments and suggestions for different products. My name is Madhava. I'm an internist, addiction medicine specialist, and a functional medicine practitioner. I can be reached at brainbodymedical.com. Please visit my website and send me an email. I also publish journal articles occasionally at my Facebook site, Integrative Addiction Medicine at Brain Body Medical. Thank you for listening, and let me know what you think about this presentation.